Sarah, very good morning to you. So let's just start with, just what DIY, I'm going to call them DIY test kits, are available in South Africa, and how widely are they being used?
Okay, good morning, Rebecca. Thanks for the opportunity. At the moment, the gold standard for testing are molecular methods, and those are PCR test kits. The laboratories are using them in the country. What we are cautioning is that all kits need to go through the regulator and be approved. There are a number of discussions around serological test kits in the country as well, and the appropriate use for these in the wider testing landscape. But at the moment, the gold standard is the PCR molecular test kit.
All right, just clarify for us, us ordinary folk, those who don't do the medical speak. I mean, what we know of COVID-19 test kits or the testing process is we have that awful cotton buds, shoved up our nose or down our throats as well. So just differentiate what happens with these two test kits. How are they actually used?
Okay, so the PCR test kits, we sample normally a nasopharyngeal swab, which is then sent to the laboratories. We are looking at the gene makeup of the virus, so it's a molecular methodology, needs to be carried out by laboratory-trained professionals to give a result. And we're looking at the actual virus itself, whereas your serological tests focus more on the antibodies produced in response to the virus, which is the antigen. At the moment, there are a number of serological test kits that applications have been placed to the regulator, possibly looking at other appropriate applications for these. So what we're saying is PCR is for diagnosis, acute diagnosis. The antibody tests or serological test kits are more looking at perhaps doing serosurveillance, looking at past infection, and also looking at capabilities of donors for using convalescent serum for testing. So those are the kind of applications we are looking at the moment. But as I need to emphasize, it is important that regulated and approved kits are used. We do not advocate for the lay public to go out there and purchase a kit over the counter because these have not been approved for use at the moment. And the other issue is around immunity and responses to the virus. We don't have enough data at the moment to say how effectively serological test kits can be. So there needs to be more research around that, and that is ongoing at the moment as we speak.
All right, so have we had people getting their hands on these self-test kits, doing their own testing at home? Are we seeing large numbers of people doing that?
We as an association are not aware of that yet, but we have issued the statement to make the public aware that this is not something that should be done at this stage. There needs to be a proper approval and a licensing scenario, in the broader testing landscape.
Sarah, what's the danger if somebody were to get their hands on this? The panic and anxiety, some people, let's talk about the hypochondriacs among us as well, might just want to get it done. They're not feeling so great at the moment, not sure if it's flu or if it's COVID. What are the dangers if they were to even try one of these at home?
Okay, so some of these tests, we're not sure around the sensitivity and specificity. We could land up with false negative results as well. There could be cross-reactivity with other viruses that people may have, perhaps the flu. So we have to really be careful how to use this, and a lot of counterfeit kits are out there as well. So we need to make sure that these are approved by our regulatory authorities before they go into use.
Okay, so the rule at the moment, don't buy any COVID testing kit that requires you to do this on your own. Do it at home. Go through the proper channels to get yourself tested if you think you're sick.
Yes, that is the recommendation, yes.
All right, great. Thanks so much then for that, Sarah Cohen. I think it's a no-brainer, Don't do this test at home because it really can't be telling you much, and you don't even know if you're actually doing this properly on your side. Just don't do it, is the word from Sarah Cohen there.